Riveting content. Empowering your life. Welcome to the Sphere. Riveting content. This episode is sponsored by
Dr. Taraya M. Richmond, PLLC. When it comes to your family's health and women's services, and you're looking for excellence in healthcare, look no further than your family medicine physician, Dr. Taraya M. Richmond, PLLC. Call Dr. Richmond today at 713-453-6962 to schedule your next appointment.
Looking to advertise? Join the Sphere's vast demographic reach of thousands of people all over the world. Send an email today to advertise@thesphere.tv or call us at area code 832-772-7789. KOG and Company. Are your unique gifts and talents changing the world? Do you desire to belong to a community of unity? Visit KOGpassion.com to learn more about the Unleash Your Dopeness movement.
Well, hi, everybody. My name is Dr. Simone Ellis, and I'm here with the Docs Show today. I'm excited because we have a special guest, but of course, Docs is here to educate, empower, and inspire and inform you guys on all health and wellness topics. And I am happy because we are going to be introducing Dr. Tamika Bush here for the day. Hey, lady. She is in the building. Well, welcome to Docs. How are you doing today?
I'm doing great, Dr. Simone. How are you?
Loving these earrings, matching this beautiful color. This energy that you're bringing to the table is awesome.
Girl, it is springtime, so when spring comes, I have to.
Thank you for telling Houston that it is springtime, because it took a minute for it to get the idea that it was hot here, right? Because I'm like, for the last 4 or 5 weeks, we were having like these cold droughts.
Exactly,
But you look like summertime fine.
Girl,
so
excited to be beautiful like you.
You know what? I will receive that, and thank you. So, guys, we're gonna talk a little bit about hot topics. One of the things I thought was cool that just came out, which is not related to medicine, but maybe we can say it's related to mindset and mental wellness, is Childish Gambino's new video come out. Have you seen it? The This Is America?
No.
Oh my gosh!
What's going on?
Childish Gambino released a This Is America video this weekend, and if you haven't got a chance to check it out, please make sure you do, because it is really, really, we can say thought-provoking, we can say it's somewhat scary, it's somewhat moving. Yeah, I mean, because in the video, he is actually showing where all these things are going on in Black America behind the scenes, and yet and still we have in the forefront, we're smiling and we're dancing, but all these crazy things are going on. So, like, in one of the scenes, he's just shooting a person playing an instrument. He shoots the guy while he's sitting down. He's like portraying that he's like a cop in America. Okay. And then he starts just dancing, and like, you know how like these memes, like there's these African kids that have been displayed on Instagram where they have like the cool dances and stuff. So he's like showing these dance movements because there's so much craziness going on in the background, and in the forefront of what's going on, you know, sometimes we miss what's going on. So if you haven't got a chance to check it out,
no, I definitely need to check that. No, I think that's amazing too, because now, especially with all the issues that we're having with like Black violence and, you know, standing up for what's right, and then just with police officers and everything else, and everybody's worried. Like, literally, I have friends that call me all the time that worry about their son, who is like 4 years old. Yeah, I mean, he's 4, but they're worried about him growing up in a society like this.
Yeah, so it definitely was a.
So no, that's awesome. I definitely need to check it out.
And I think that did we talk about this last week? Well, I think Kanye had not had his breakdown.
Oh my gosh, Kanye!
Like, I don't know if he had. I think he was like on the brink of the breakdown. But like, if slavery was a choice, have you seen all the memes on Instagram? It was hilarious. The internet never fails to make my days happy. I mean, where were we 10, 15 years ago when like Instagram didn't exist? I'm like, it was great. Like, the memes were hilarious, and from a mental health perspective, because I guess that's medicine. We can talk about that. Right. What are you thinking about Kanye's state of mind? What do you think?
Girl, Kanye, that was some crazy.
Yeah.
I mean, for him, he's very bold. I give him that. For him to have the profile that he has and the platform that he uses, he's very bold. I know it's freedom of speech, but sometimes I just realize you can go out and you can say things, but just think about it first before you make a statement. And that was a pretty touchy topic.
Yeah, and I mean, we see two different people using. I just use Childish Gambino as one person, and then Kanye as another, using their platforms, but having a completely different message.
And with him being a black man to talk about
from Chicago
and that aspect,
and his mom was an African American professor.
Right, I'm like his mom.
Yeah, African American history professor. Yeah, so it's kind of like better, like and like people keep saying that mental health card, and sometimes I guess what he's trying to do is say, like, is it because I have freedom of speech that you consider that I'm a mental health risk? But I guess I'm thinking to myself, like, well, some of the stuff that you're saying would make anybody question, like,
what's going on logically.
Your sanity.
Like, your sanity and what you're thinking.
Yeah.
And, it just brings to light more and more the stigma of mental health in the Black community. And so how when we have issues that are going on with us, whether it's depression or, we're having suicidal tendencies, that's something that we need to kind of make sure we tell someone.
Yeah.
Because we don't want it to be last minute or late. And it's too late. Or you're in a mental ward, you're committing suicide and someone's at your house and there's an ambulance there and you've almost overdosed.
I think one of our episodes we talked about depression, and we talk about how in the community it's a big stigma, and when you feel like you're not your happiest self, who do you go and to? Who do you go and tell? And like, what's going to be the ramifications afterwards? Like, what happens when you express that? And so, on the sad side for Kanye, I feel bad because he has brought to the forefront his mental health. Like he said, he's had some issues. But on the flip side or the negative side about that, what is he doing to make sure that stays in check? Exactly. Even in that interview, he talks about how like the doctors wanted him to be on a certain amount of medication, and he decided he was just going to only be on one pill. And you like, yeah, I can see how that one pill is
like
helping.
Our patient population, non-compliant.
Yeah, like,
there we go.
I don't need all that. I just need this one. And then you're like seeing this interview, and you're like, but if you would have taken all three, you might not be saying this right now. So. Guys, we don't just study these things for no reason.
Exactly.
We don't just tell you these things for no reason. We really want you to be compliant because it would make a really big difference.
And if we're telling you something that's going to improve your health and balance to you, please take our advice.
I mean, seriously.
Because anything that you're going through that affects you, keep in mind, if you have a family, that it's going to affect everybody around you, not only your family, but your friends as well. So it's totally important.
And so I just think that Kanye needs to keep the Kardashians. It's like a vacuum.
Exactly.
I'm like, they must have a mental ward in their house, and they like, what you going to watch? It's like
it's the quiet room.
It's the get out room in the basement where they all sitting there and they like, we get all these.
We just gonna go to the room. We gonna pick a weekend and we just gonna go to the room.
Yeah. Exactly. So we got a lovely, beautiful co-host came here with ponytail popping.
Hey girl, pop them ponytails.
How old are you today? You look like a good 15.
Thank you. They were like, so how are you? I was like, I'm almost 40.
Exactly. Almost.
You tell him, girl.
But you looking 15.
That's what she said.
You look cute.
Thanks.
You do super cute. So we were just talking about mental health and wellness, his funness, and then Childish Gambino. We just talked briefly about the video.
Was awesome.
Yeah, so she's gonna check it out when we.
You
haven't seen it yet?
No, I haven't seen it. I'm like,
it's
disturbing,
it's good.
And exciting, and crazy all in the same.
It's a good conversational piece, I think.
Yeah.
Okay.
I think that it means a lot for have these kinds of conversations. Not even married. Like he's wrote a poem 2 years ago about how he wished he was white.
Oh no, he did.
Yeah, Childish has been kind of
Okay, so he's always
playing.
Yeah.
Okay.
And he is married to a white lady. They have
Asian,
children.
like, right too. Like
maybe.
White. Okay.
Maybe, but she is not. She's not African American. How about that? So yeah, he's very. I guess maybe he would consider.
Something.
Okay.
Well, Dr. Tamika Bush, we didn't get a chance to introduce you, but for the
sorry.
So tell us a little bit of where you're from, what school school you do, and how did you find your journey into what you do now?
Yeah, no problem, no problem. For everyone that doesn't know me, my name is Dr. Tamika Bush. Otherwise, a lot of my followers know me as Dr. Tamika Peds. I am your favorite board-certified holistic integrative pediatrician, doctor, mom, coach, speaker, and advocate. I'm a sickle cell advocate, which was the reason of why I went into holistic integrative pediatrics. One of the things with my history is that I'm an osteopath physician by heart, okay? And so an osteopathic physician, it's different than allopaths. I have my doctor of osteopathy, and I always was attracted to whole body wellness. Ever since I was in high school, I remember whenever I got sick, I was just like, Ma, she was like, go get some medicine, go get something from like CVS or Walgreens. I'm like, no, there's a herb for that. I'm like, there's something else I can take that's more natural. So it's always been a passion for me, and it's always been a part of my heart. So when I wanted to go to med school, I decided to look up alternative reasons, like different backgrounds to kind of go into, and I looked into osteopathy medicine.
Okay.
And so Andrew T. Steele is actually the founder. He's actually an MD turned DO, and he felt like the whole body was interrelated. So he felt that, you know, even though we have like these muscles and these connections, and also as well as like the bones and the ribs, everything is connected to the whole body within the organs. So there's different treatments that we can do. The treatment is osteopathic manipulative treatment, okay? So it's different than chiropractor. So a lot of times with my patients, what I can do is I take a time and not only get to know them as a whole person, but I also can kind of do a full body exam where I can look at their cervical spine, look at their back spine, do rib raising techniques, muscle energy. So there's other techniques that I incorporate into my modalities for my whole body wellness for a lot of my patients. My daughter is the reason of why. My daughter has sickle cell, and so I'm a sickle cell advocate. One of the reasons I like to educate a lot of people about sickle cell is it's a chronic medical condition. It's one of those things to where a lot of us, even in the community, a lot of nationalities, most people think it's an illness of Black people, but it's not. It's across all nationalities.
Oh, wow.
You can see it in Italians, you can see it in Mexicans, you can see it in an Indian population, and it's across all avenues. But I think people need to be aware that it is a chronic medical condition, and it's a blood disorder that basically, just to give everybody a gist, it's a blood disorder that causes your sickle cells, your blood cells, to be an abnormally shaped. And because of them being an abnormally shaped, they don't flow through the blood vessels like they normally do. And if you guys know or have anyone else that, you know, in the family that has sickle cell and you hear about them always in the hospital, it's because they went in for crisis, or they went in because there was concerns of infection or something else. It's because their sickles, their red blood cells are abnormally shaped. As they flow through, they get stuck. And that stuck and that sludging causes things to not flow through appropriately, causing the pain crises, leading to a lot of pain, individuals, also leading to strokes and a lot of other illnesses as well. And so, you know, there's simple techniques that you can do to kind of help alleviate that, but this is a lifelong condition. The only cure is a bone marrow transplant. And so, and it's passed genetically between two people that decide to have a child. And I think one of the problems is that we're trying to educate more people on getting tested out there, because a lot of people are not aware that they have the trait. I was aware that I had the trait because I was in the medical field and I knew to get tested. But when you marry someone and you fall in love, the first thing that you're not thinking about is, okay, do we need to check to see if we have sickle cell trait? Yeah, you're thinking of, okay, is your child going to come out normal, or what's going to happen? But you're also thinking about, okay, am I going to be able to get pregnant? But as two people, especially two African American or two people that are in a different culture as far as Asian descent, or if they're in another Mexican, you always want to make sure that you get tested, because that's important. It's a 1 in 4 chance too as well.
Right. And so before we get into a little bit more detail about sickle cell anemia, we want to go ahead and talk about this portion of the show is sponsored by Dr. Taraya Richmond, PLLC. So, I mean, she's a primary care physician where you could get a chance to actually probably get screened if you're going to see her. So finding excellence in healthcare is no easy task. When you begin that journey, look no further than that local family medicine physician, Dr. Taraya Richmond, PLLC. Dr. Richmond offers an array of services, including pap smears, breast exams, STI screenings, contraceptive management, prenatal care, and so much more. So, guys, take this number down and call Dr. Taraya Richmond at 713-453-6962 and to schedule your appointment today. So
as a holistic integrated pediatrics. So, I mean, I have kids.
Yeah.
I have 3. I tell people all the time.
You look good.
Stand back, girl.
I got a
gang of kids.
You look good. You look good.
I do. Like, I do. I really do. So, and by the way, I have sickle cell trait.
Oh, okay. Okay.
Quinn has sickle cell trait, my daughter. Avery has sickle cell trait. Logan, I think, is the only one who did not get the trait. Anyway, so tell me something, for instance, my son has asthma.
Right.
I hate giving him the steroid. Mm-hmm. Like, I actually... It kills me to give it to him, even though it's supposed to only be lungs. It's only supposed to touch the lungs. I just don't believe in it, right? But I can't have him going into a asthma attack. Yeah. So as a holistic provider, give me some examples on what that would mean for a son like mine.
Yeah.
Severe allergies and has asthma.
Okay.
Or even like what is holistic for people who
don't know.
What's
so
holistic integrated.
Yeah, maybe use like how you would
kind of tailor my visits.
Yeah. And then like my son, who I do believe almost everybody in Houston has allergies. Do you have allergies, Simone?
When I moved here,
my allergies got worse once I got here.
Okay, I didn't have a problem, and then I moved here, and I was like, "What is this?"
The smog. So no, absolutely. So just for everybody that doesn't know, I'm a holistic integrative pediatrician. So I do a blend of conventional and holistic therapies. So I am also homeopathy trained. Okay, so being that I'm homeopathy trained,
what is
and
it?
And I'm about to, and I also do osteopathy. So homeopathy is it's a holistic medicine. It's a form of herbal medicine that you use, and it's actually a diluted, it's in the area where like heals like. Okay, so basically you provide your body with a substance that is actually naturally occurring, whether it's a mineral, whether it's something that's an animal byproduct, or whether or not it could be something else out there, a plant derived. And so when you give yourself small amounts of a substance that already produces that same effect, it leads your body to natural healing. Okay. An example, onions, right? We all know that onions make us cry. All right. So a homeopathy med would be, there's a homeopathy dilution for onions that you can use for hay fever, because you get sneezing with onions. You also get crying with onions. So there's a homeopathy version where it's like a diluted amount of onion that you can actually give to patients for cold symptoms, and you can also give for hay fever.
So it prevents you from sneezing, or it makes you sneeze?
No.
It's almost like the flu vaccination.
It's actually
like
giving you small amounts of the substance, so your body almost builds a tolerance and it heals itself naturally. Okay. And that's the whole point. Okay. And instead of, like, an example for you, you talked about asthma or allergies. I get a lot of kids that I deal with eczema. So usually we see the triad. We see asthma, we see allergies, we see eczema.
My son.
Right. And of course people say, well, you know, Dr. Bush, I don't want them to be on Zyrtec all the time. I don't want my child to constantly have a topical steroid, because what do? Topical steroids, yeah, your doctors say, yeah, they're short term. Bless you.
Oh my God.
You need some onions. You need onions. Now, if you start smelling, I'm gonna tell you.
Somebody, please.
I'm gonna be like,
somebody. Let me know.
So you're not sneezing. However,
exactly.
You smell like onions.
Like an onion. Make them cry on the eye. I'm just joking.
No, we are so good. So basically, topical steroids, they can cause like dysfunction within your thyroid, kind of seep into you. People don't realize giving something yourself toxically, it still goes through the skin. The skin is still a barrier to your body. So repeated applications, you get small amounts over time that kind of seeps through. Even if you do medications or steroids, can it affect the growth long term? Inhaled steroids, yes, all of those things. So if I can figure out a way to treat my patients and do something more naturally or homeopathy derived, or adjust their diet, I do whole body wellness. So one of the things that I do, being that I incorporate everything, the best thing about homeopathy is it's individualized. Okay, so when you look at the patient's allergies, their triggers, you look at their whole environment. So homeopathy looks at the whole person. It also looks at their environmental. Like if I have a child that I'm treating for eczema, I also find out that she has constipation. I also find out that she's a shy pooper, to where she doesn't like to poop at school, and she has tantrums. I can give one medicine that can treat all 3 or 4.
Wow.
Right.
I've never even heard of shy pooping.
Yeah, and it's one of those.
I used to be a shy pooper.
I've never even heard. These are just
some
cool
people.
things.
Yeah,
Okay.
some people are just shy poopers. They poop at home, but they don't poop out in public, and they don't poop when they're at school, and so they're just, we call them shy poop. But that's
I'm
actually
not a shy pooper.
You're not. You can just go.
just go.
I'm still a little bit of a shy
like, if
kid.
it's coming, I'm
It
going.
depends on where I'm at, because sometimes if I have to go, I'm like, I have to go.
I just gotta go. No, I don't.
I can reel it in.
I know it's like TMI for everybody that's listening, but yeah, we're giving you a little bit about our digestive.
At least
this
you
is a
need to
doctor
know,
show.
right?
It's a doctor show. Digestive habits.
It's not good for me.
I go flow.
It's not good
I'd
for
be like,
you.
let me put multiple barriers on the toilet. It's just time to get
no
into my
way.
peas.
There's no way. There's no way.
And I always
start looking around. I look at like
No.
if there's crust in places, like I get real.
No.
Like,
Oh, you get really.
God.
Yeah.
I have like breathe and release. I'm just like, well,
oh my God, no way.
That is too
and
funny.
sitting back in a public. Oh God. No. Did you sit back? No way.
Wait, she
time.
said breathe and release.
yeah,
No,
like
like I literally
Time.
thinking about that makes me like kind of dry heave just a little bit.
That. I see that. You're thinking about it in your head.
Like I have to perch.
Oh
Don't
my
come sit
God.
next to me next to the toilet.
No, I
Oh
won't
my
because
God.
I'm not.
And then you
been
come
there
out
long
when you
enough.
walk out. When you walk out, you're just like,
I don't even like. I'm kind of a shy peer too. Like
Are you
I
a
don't
shy
like,
peer?
I don't like
Really?
to pee in public either.
Oh.
My best friend was like that too. She was like, I gotta go home. I was like, to go take a poop from school?
Yeah,
You're
some people go all the
kidding.
way home or they hold it. But
yeah,
that's what leads
a
to,
problem though, right?
Yeah, but that's what leads to the recurrent constipation in the kids.
Yeah.
And so they get backed up, and the next day you get backed up. And so, there's treatments that we can give for that, actually. And there's
Wow.
osteopathic treatments that I can do on the belly with a lot of my patients if I put them up on my bed that can help get things moving. And so I also do essential oil therapy. I'm an aromatherapist, so I actually do that. So I do the full gamut, and I blend everything together. So for your son, there's a medicine out there called histaminum. That's a homeopathic medicine. I've been using that along with my daughter. And so whenever, allergy season starts, you're supposed to start it 3 or 4 weeks before. The dose, the great thing about homeopathy is it's safe.
Yeah.
Most people always say, oh, well, what is the deal? It's, being questioned by the Food and Drug. No, it's been actually approved by the Food and Drug Administration ever since 1938. It's a safe medicine, and I love it because it's so safe. It's safe that you can even give it to pregnant women, that you can give it to babies and infants.
Well, because they're natural occurring elements, right? Or your body already makes a version of it. You're just recreating it in some other form.
So you need to be getting
hello, absolutely.
Rad dude on some.
Rad dude.
Rad
No,
dude.
sometimes he only answers to Rad dude. So.
So Rad dude needs to be on. What did you call it?
Yeah.
Histaminum.
Histaminum.
Yeah, that's a
Awesome.
possibility.
That's
Yeah,
awesome.
Rad dude probably needs to be on several different things. However, let's wrap up right now Facebook Live so that we can. No, we're not on Facebook Live. Did you know that?
Well, no. So
we can move on to.
We could just keep moving.
We could just move.
So all right. So
we had a technical glitch today, so there's no Facebook Live.
okay.
Okay.
So
Perfectly
why
fine.
is holistic medicine different? Like, why do you feel like we found out why you kind of went into it? What school did you go to even?
I actually went to Kansas City University of Medicine and Biosciences in Kansas City, Missouri.
Did you know I'm from Kansas?
No!
Born and raised. It's hilarious because on this show, 2 people being from Kansas. I'm like, I'm
But
winning.
no, Kansas City, Missouri.
But like, it's the same.
but they're
It's
not.
like I live literally like Sugar Land, Missouri City.
I
Like,
used
it's
to
the
actually
same.
go to UMKC to actually study on the weekends because it was like one
Okay,
like
so what is UMKC?
University of Missouri, Kansas City. That's where my mom got her doctorate too.
yeah, I'd go there just to get a break from my campus.
excited.
But yeah.
dope.
And it was like literally a 20-minute drive.
You like
from where I
Gates
lived. Yeah.
barbecue?
Oh yeah, girl, I love me some Gates.
I just had some
Yeah.
last night.
Really?
She got the freezer. I was like, you know what? It's a Gates time.
Oh wow. Yeah, I love me some Gates.
You
I used to love going down to the
Froze
plaza.
barbecue?
Yeah, because I don't go. When do I go home?
I don't
like
know,
never.
but
Nobody lives there anymore.
freezes
It's like
barbecue?
man, my mom went for a
She
funeral.
froze her some barbecue.
And I was like, Mommy,
How
I
is
need
that
you to bring me
possible?
2 racks back
How is that
and
possible?
put it up there. So yeah.
That's impossible.
All right.
However, maybe we could call. Who is this? Grix? Who?
Gates.
Gary's?
Gates.
Maybe they can sponsor an
Don't
ad.
knock it.
You said
you try it, ma'am.
They do have some good barbecue. They make
I
their
know we
own
talking about
sauce and everything
holistic
else.
stuff, but
Well,
like,
however,
and I know beef ain't, but like I pork, but this show is
It's good.
It's
so
good.
so if you are actually starting a business or you would just like to find a place to advertise, we are the spot. Right here at the Sphere. If you have a need to reach thousands of people to build your brand or sell your product, if so, you can get your product placement and advertising needs handled right here at the Sphere. We offer a wide variety of content delivery platforms, including iTunes, Google Play, SoundCloud, YouTube, and Stitcher. Plus, we have a vast demographic reach within the United States as well as modern countries across the globe. Our enriched content and inspiring dialogue, coupled with your strategic ad, is surely to hit the mark every single time.
Yeah.
Call us today at area code 832-772-7789 or send an email over to advertise@thesphere.tv.
Well, and I know we want to get into something that is super dope, too. I love when doctors are kicking butt and having books that they release.
Let me tell you something. I need to come up with a book.
Seriously.
Okay,
this is
first
like
off.
amazing. Do you see this flawless
No,
black
I see it.
magic?
I got sidetracked when I got here because I started reading the book because I was like, this is cool, right?
So
Secondly,
guys,
I get bitter because it's like our third show in a row that
and
we've
these
had a
doctors
doctor
are
with a book.
killing books. Like, so guys, let's first
Whatever.
give her amazingness. Common
I'm
germs
bitter.
of supernatural cures.
Thank you.
Like,
Where
I'm
can we
hating just a
find-
little
No,
bit.
you're not. It's
Where
a
can
No,
we
I'm
support.
not.
find
I'm happy
this
for you.
book?
I'm happy for you.
Thank you. Thank you,
Where
guys.
can we find it, and what is this book about?
Yeah, so in
Needs
this
for your
book,
child, right?
I am so blessed and honored. This is something that has always been birthed and always I've had in my heart, and it's finally been birthed. So in this book, I talk about common childhood conditions in the book. So anything from treatments to pink eye to common conditions that we see in the wintertime, croup, RSV. And it's great because I even give recipes. So these
look at this. She said fever gone tea popsicles.
So these are actually recipes I've used on my own daughter. And so what great way to use the recipes if you know a pediatrician and a doctor mom did it, right?
That's
and
dope.
so I have recipes in there for cradle cap. I have recipes for fever reducing popsicles. I give like a whole chart on essential oils, talking about how to use them, if they're antibacterial, what common things, what essential oils that you need to look out for, and what to have basically in your home
really
unit.
cool,
And so
guys.
it's an amazing book. I love it. I give all glory to God. My
I
daughter
just think
is.
this is so amazing.
Thank
Like
you.
you're right.
Thank
Like
you.
we're not doing enough in life. Like you ain't got no
I mean,
book on Amazon.com.
You know what? I had to
Like,
have a push. And being physicians, I'll be honest, we ourselves have to have that motivation, that push. And I had to have a coach.
Tell us about that.
I had a coach. Dr. Dre was my coach. He was awesome.
He's
Like
super
the rapper?
cool.
Yeah, I know, right? Did y'all see it? Did y'all see it?
He got his name back. Praise
Sure
the Lord.
did. Praise the Lord. It's just like, oh my gosh. But no, Dr. Dre is awesome. Dr. Dre and I go back years, but when I saw everything that he was doing and learning how to monetize your medical degree and just figure out ways to realize there's different avenues. I mean, as physicians, we have the highest burnout rate. Whether you're a dentist, whether or not you're a physician, I mean, it's hard out here. Everybody knows the struggle is real.
It's been so easy. Like I breeze through this every day. Like,
Oh, look,
right.
this is
Today
week
I literally had to-
2 in a row that my Mondays have started out shitty.
Right, exactly.
yeah, it's terrible.
Two
It's
Mondays in a
So,
row.
I mean, through his guidance, even good physicians and good coaches, because I'm a coach too as well. I coach moms, I coach other physicians, but even good coaches need a coach.
Oh,
and I think you just need that push.
I say that all the
without
time.
him pushing me, I don't think I would have ever gotten that done. So I'm just happy and blessed at its birth. So if anybody wants a copy,
Yes,
go to my
please tell them
website,
where they find you.
www.drtamikapeds, that's DRTAMIKAPEDS.com. Feel free to go on the website. Actually, if you guys are interested too, I am accepting new patients. I am doing virtual consults. So I accept
that's
patients
nice.
in the Texas area where I do virtual holistic medical consulting for a lot of parents and their children on childhood conditions. I have a lot of parents that come to me because they want to use something else besides an ADHD med, or someone that comes to me because there's even medicine. I don't know if you guys know that. Remember how you have one kid and then you have another kid and then the other kid gets upset because the new kid's here. There's actually a medicine for sibling like rivalry and tantrum. Did you guys know that? Yeah, there's a medicine you can get for that.
Does Brad do need that?
So
No, Rad Dude needs a lot, but that's one thing that he doesn't need.
So people don't realize
Dude.
there's something, and it's a natural holistic medicine, something that you can kind of
didn't even know that.
tame the forces in the house.
Really?
So to kind of bring a little bit more balance to the home.
I like sibling rivalry. It creates
Oh,
it
stop it. Okay. So
it creates a competitive spirit. Early.
are some of the challenges? I'm not even
It does.
entertaining that
It does.
point.
I think it's great. I think it's
so
wonderful.
oh my goodness, it is hot in here.
It's just because
ladies.
it's so much amazingness
Ooh,
going
I know,
on right
it's
here.
like
So much brain power.
Amazing. There's so much beautiful women.
Or the
up
air
in
conditioning
here.
is off.
We
Either
are
way.
burning up,
Really.
y'all. Y'all should see me. I'm glistening.
What are some of the challenges that you face? Oh, go. Sorry. I didn't see it.
You just gonna jump into KOG
Just
like that?
Pew!
Okay, so what we're not gonna do
What we're not going to do is
interrupt my friend.
Sorry.
Okay. All right.
Sorry, I ain't
So
sweet.
KOG and Company is actually sponsoring this portion of the show. Are your unique gifts and talents changing the world? Unleash Your Dopeness is a people empowerment movement built to encourage the masses to operate outside of their fears and have the gall to recklessly pursue their dreams and passions in life. Join thousands of others as we unlock the greatness that dwells inside. Shop dope gear at KOGpassion.com. That's KOGpassion.com and use coupon code DOPE for 10% off exclusive Unleash Your Dopeness apparel. Act now. Sizes are selling out fast. Well, if you don't mind, we know that you've had some challenges, right? You have a daughter.
Right.
How old's your daughter?
She's 3.5, soon to be 4.
Well, congratulations.
Thank you.
We also know that she has sickle cell, which has motivated you into kind of following this path that your heart has always been, your spirit's been saying since you were little, right? However, can you give us some challenges that you faced, in this particular field that you're in?
Yeah. I think, one of the things that, we have to deal with now is it was tough. I was the first physician in my family. Okay, so being the first physician in your family, that puts a lot of stress on you as it is. And I'll be honest, being a doctor was something that I've always wanted to do. I knew, most people don't really know what their passion or their purpose is. I can honestly say that I'm doing that. So I'm really blessed to be able to do that. So I knew I wanted to be a doctor ever since I was 8. But, you go through the process of taking the MCAT and, you apply to med school and you're like, oh my gosh, is it really, you have to go through all this? And then when you find out you're accepted, you're ecstatic. And so along the lines, I'll be honest, people that you normally think would have been happy for you, you encounter some avenues of jealousy along. As you go up, sometimes you don't have friends or family members that kind of go up with you. And there were times in my life to where I did encounter that. I lost a few friends on the way. There were times where I questioned whether or not some of my family members could have been more supportive when they found out certain things about my life. But, you take it in stride, and it's one of those things, too, where they say it doesn't kill you, it makes you stronger, and it pushes you. But I'm also not a person to hold grudge. So I'm also a very spiritual person. So I have a lot of faith in God and a lot of belief in God. And so when it comes to situations like that, okay, I leave it up to him and I let go and I let God. But one of the instances, when I kind of got into med school, the biggest thing that I worried about was being a failure. I'm not going to lie. I was like, I'm the first doctor in my family, and I'm like, what if I go here and I bomb out?
I wonder if that's something that people who perform at that level deal with, because failure for me is a big issue, and it's like one of my biggest. Like, if you have worse fears, failure is mine.
Yeah.
I don't know. Do you feel that way as well? Like,
I feel like that's half of the reason why the ones those of us that kind of don't ever give up and keep grinding through it, even when like walking away is just as easy or it's easier. We don't. Failure tends to be a motivation for a lot of people.
Yeah.
The fear of failure.
The fear of failure.
Yeah.
And it pushed me more. But being in med school, like I remember studying and then realizing, oh my gosh, 3 weeks went by and I hadn't talked to anyone in my family. I hadn't talked to any of my friends because I was on the grind.
Right.
And so the other thing about being in med school, I mean, how many blacks do we see in med school?
Right.
Or any type of professional.
And you were in Kansas?
Yeah, graduate education. So, and I'm not going to lie, y'all, like in my class, literally, it was probably, because, they wean you down that first year. So through testing and everything else, going through that rigorous med school environment, you're going to see whether or not you're going to make it in that first 6 months. Yeah. But we had maybe a little over 100 people in our class, and out of 100 people, there were 10 that were black. 9 of the 10 were females.
Wow.
There was one black male. So, and people were like, oh, well, I remember when it came down to dating, and they were like, I'm like, dating? Who's talking about dating? I'm just trying to make it through this thing called life in med school. And people are like, oh, well, you'll meet your husband in med school, or you'll meet somebody. I'm like, that's not the black story. Right. Exactly. I'm like, that's not my focus. I'm here. This is my dream. This is my goal. This is what I want to do. And so I'm going to go all out. You either go hard or you don't go. Yeah. So it was one of those things to where, did we face some issues with probably, whether or not, we were I was a black female. Did I always feel like I had to be on my P's and Q's and on my game when it came times? Yeah.
And how many people ended up finishing?
Actually, out of the 10, all of us did.
That's wonderful.
It was actually one. I think one that dropped off, but all of us did majority. Yeah,
that's
awesome.
wonderful.
So that was a blessing.
So where do you see yourself? You got this book. You have, I'm supposing, a practice that you practice.
Yeah,
in?
actually, I do virtual consultations. So
Okay.
I'm a medical consultant for pediatrics.
Okay, wonderful. So where do you see yourself in? What's next for you?
So here's my thing. One of the things I want to reach out to parents to, because my goal is to reach other parents and other caregivers and other moms who are just like me. I mean, I understand it. Being a mom, it's hard. Being a parent in general, it's hard. So one of the things we deal with, especially if you're full-time working parents, you're not always available to go to the doctor.
Yeah.
Okay, we know you have to take your child in when they're sick, but if you can find someone that you can talk to or do a consultation over the phone virtually that can give you the care that you need for your child and natural and holistic ways, then why not do it? And so that is my goal. My goal is to reach out to those families out there that want that part of that life. And nowadays, you know, virtual visits are kind of increasing. And so I'm trying to reach out, and I'm building my clientele now. So I'm taking new patients. And so one of the things is I'm reaching out to anyone that is interested. I'm doing a 15-minute consultation that's for free. If anybody's interested in going to my website, they can go to www.drtamikapeas.com. There is a link for you to book a visit with me for a 15-minute consultation. That way you guys can talk to me directly to determine if I am a good fit for your child, because I understand you want to find out, okay, what is this holistic integrative? What type of treatments are you willing to give? And then we can go into more detail of what concerns that you have as a parent for your child. If you want to get them off of ADHD medicines, if you want to reduce the amount of ear infections that they're having, you know, there's treatments that I can do that's natural and holistic that can reduce the amount of ear infections so they don't get put on repeated antibiotics and things. So feel free to reach out to me. I'm giving free 15-minute consults just to determine if I'm the right fit for you. Go to my website. Once again, it's www.drtamikapeas.com. My goal is to reach the mass. I just want to be not only an advocate and be there for other moms to have other avenues to keep their children happy and healthy, but I want to be there too to let them know that it's possible. Having a child with a chronic illness, it's possible. My child has not been in the hospital since she's been born. At 6 months, she had seizures from her sickle cell. And I was just like, no, she is not going to be addicted to narcotics. She is not going to be constantly in the hospital. And I knew that I had to find an alternative, and that's what I did. And I've kept her out of the hospital. And she's 3.5. She's healthy through God's grace. And so,
awesome.
you know, for me having that ability, I want to reach out to other families out there to give them that opportunity to keep their children healthy, to help them thrive. Because I realize that having a healthy child, healthy children just lead to happy moms.
They do.
That's
They do.
awesome.
Totally there.
Well, I mean, I'm glad I was able to make it. I was late. You know, typically I'm running around like a chicken with my head cut off. So today was one of those days. So I am so glad that I was able to make it, because I definitely believe in at least having some options for your child. Like, if you don't want to be a traditional medicine taker, then I believe that this stuff is wonderful. This is kind of what our ancestors grew up on. Like, this is this to me is a better fit for many people. We just aren't traditional. We're more traditional thinkers. So I think it's good to open it up.
And then just to kind of counteract on that, most people think that since I do natural and holistic, that everything, I'm not against antibiotics. Like, I realize if your child has sore throat, or if they get diagnosed with strep throat, they're going to have to be on amoxicillin to help prevent like rheumatic fever and stuff.
Right.
But one thing about holistic therapy and the therapies that I use, you can do them in conjunction with traditional medicine. So like, say if your child is on an antibiotic, there's a homeopathy medicine I can use to help decrease yeast infections, to help decrease the diarrhea side effect aspect of the antibiotic that they're on for like strep throat. And so I just want everybody to be aware too that I can be used as a conjunction to your current pediatrician.
Well, and I also think that there is a way to do some of the stuff I was reading while we were talking, that there's some like daily remedies that you can just kind of take every day, like the immune booster that's in here, that's like honey and ginger root and something else was in it. But things like that like, why not have it kind of every day to kind of keep you healthy versus even having to maybe combat some of these kind of childhood germs. So we really appreciate you coming.
Man, you were fantastic.
Thank you so much. We are very proud that you are
I just love the
an
show
illustrated.
because we get a chance to see this.
Yeah,
that's great.
Thank you, ladies, so much for having me.
Absolutely. So thank you so much for coming. Of course, I am Dr. Chandra Persiz. I didn't even get to introduce myself today.
We know who you are.
Well, for those of you who don't. I'm 38.
world,
I wear ponytails on top of my head, and I'm late all the time. So I also go by Dr. Chandra Batiste. I'm a dentist. I own Elite Dental Wellness, which is a dental practice located right around the corner from here on the corner of Fondren and Westheimer. You can reach me at 713-789-8680, or you can go to my website, www.houstondentalwellness.com. Of course, you can always follow me on any of my social media platforms, which includes Instagram, hotdog.com, and Facebook, Twitter, Snapchat, etc., Chandra Batiste.
She's so much more lively than me. And guys, I'm Dr. Simone Ellis. Of course, you can find me on Facebook at Simone Ellis or on Instagram at Dr. Simone Ellis, and my office, Smile to Science Studios in Missouri City, Texas. And it's been a great show. Thank you so much for having me on.
Thank you so much.
We appreciate it.
Feel free, everybody, to follow me on Instagram, Twitter. I'm also across all avenues of social media. That's at Dr. Tamika Pees. That's DrTamikapeds. And I look forward to talking to you future moms out there, and also moms that want to keep their children happy and healthy to help them thrive. Take care.
Love that.
What? Peace out.
Guys.
See y'all later.
So this has been